guys, I'm going to be going over an intervention that we use a lot for hemiparesis, or just really retraining, integrating movement patterns back into the upper extremity. So I have my patient positioned usually on a tall back chair or on the mat table. I always make sure that they're in good positioning in their lower body. So 90, 90, 90, we all know the drill. And then I'm going to have just these anti-friction plates that I think I got at like for $3 or something. And we have one for the upper extremity, one for the lower extremity. So we're not, you know, your feet aren't touching, your hands aren't touching where your feet are placed or what have you. So I'm going to pull the table close to their side. They're going to position, or I'm going to help position their elbow and their hand on these discs. And we're going to begin watching for compensation in the trunk with some elbow extension and shoulder flexion, forward and back, forward and back. We're going to do many, many, many repetitions of this. You want to make sure that they're not doing this, all right? We're decreasing compensatory movements. Sometimes I'll give them a light TheraBand resistance around their midsection or on the back of a chair, so that they're not making sure that they're not feeling that pull, so that they have some kinesthetic awareness of whether or not they're compensating. You can also position a mirror in front of them so that they can see, make sure that their shoulders are even, make sure that they're not leaning forward with their trunk, and that they're just moving that extremity, right? I educate my patients that your brain wants to just go with the path of least resistance. It does not care about compensation. And in fact, it utilizes compensation strategies in order to just move, right? So movement like this, just because we got further with the discs, I would prefer true movement over compensated movement, right? So just make sure that you're aware of that when you're working with your client. So we'll do shoulder flexion, extension. Then I'll also work on a lot of external and internal rotation, because that tends to be a very hard movement for individuals. So if they really only have trace activation, I will be guiding them at their key points of control, right? Their elbow and their wrist, helping to facilitate. Oftentimes I've noticed that people have more internal rotation off the bat than they do external rotation. So bringing their hand, their extremity out to here, and then having them come back into their body, really emphasizing a good amount of force, forward, back, external, internal. You can position the chair, however, if you're just working on internal and external rotation, you can position it so that you can get more internal rotation. But I use this with a lot of individuals. It's really good gravity reduced plane to work in, so that they can continue to make gains in their motor relearning continuum. So highly recommend. Really, really good one. Another thing that you can do with these discs, how am I going to turn this here? Go this way. You can do some hand over hand. Going forward, a little bit of trunk flexion, right? Forward as much as you can, and back. Forward and back. You can position this any way that you need to. If you want to kind of go off to one side a little bit more than the other, right? You can put two different targets. You can go to one side, to the other side, and then forward, right? Making sure that our back is nice and tall. And you can cue some trunk flexion, right? Hinging at those hips. But that's another one that we'll do as well. So these plates we use for a lot of different things. Again, very economical. This can be easily translated into the home, so that they can continue the repetition and the consistency that is required in motor learning. If you guys have any questions or comments or anything that you want to add to this video specifically, please make sure that you're commenting below. And if you want more of a clinical conversation, then make sure you're hopping into your Marco Polo community groups so that you can discuss further with the practitioners in that group. So I will see you guys in the next video, and I hope that you found this helpful.